It comes with lidocaine, it comes with a filter needle. It should come with, what am I looking for? Oh yeah, the drape. So ChlorPrep 2, and then this thing itself is the drape. This drapes the whole entire patient. So what they're going to do is put the opening, if they're putting one here, they're going to put the opening in this area, and then they're going to, the drape will go up, and the drape will go all the way to their feet, because that will just for their sterile field. Sometimes for patients that's difficult, they don't like their faces covered, and it's a little scary and intimidating, so sometimes I try to make them like a little tent under there, so they can breathe better, or put them on just a little bit of oxygen for the procedure. That way they feel a little more comfortable kind of getting some air, because it does get pretty hot under there. I mean, it's just like putting almost like a plastic bag over your face. So, and sometimes depending on the physician, if it's like a resident or somebody who's training, it's going to take them longer than maybe a regular physician. The only thing that this thing does not come with is flushes. It does not come with flushes, and it does not come with caps. It comes with these lovely caps, but you need the actual IV caps on there, and they do not come with that. So usually what your job would be is to already have all that stuff prepared. The normal saline, usually the tube itself is sterile, so you can pop those open and drop them onto their sterile field along with the little caps, and so then they'll flush the caps and put them on here and things like that, so you have that. So that's one thing that you'll work on getting ready for them as well. Other than that, they will have everything. Also, this does not come with a dressing. So you'll want like a Tegaderm to put on there. They should suture that in. Some places do have they call it like a t-shirt and pants. It's two separate dressings that they put over to secure it in place. Usually they just suture that in so it doesn't come out. And then you just put a nice dressing over that. And when you put the dressing over it, you need to make sure that you're sterile and everything like that, because that's a sterile area. You don't want any infection in that. Any questions? Okay. So you might help do that. I know Dr. Fedorov is going to talk about art lines. That's also something that nursing staff can help put in as well. Does anybody want to look at the kit? See what's in there? Let me pass it around. It's not sterile. Be careful, there are needles and stuff in there, so just be careful of that.
How long does it take them to do a central line normally?
Oh, like 30 minutes.
Because there's like a central line team with IV therapy, right?
That I don't know.
Okay.
I do not know that answer. That could be. Now if they're doing like a PICC line, things like that, usually nursing staff does that. Or IV team will do that, and they come with everything that they need.
Okay.
So usually you don't even need to be in there because they do it all.
Gotcha.
If there is some kind of team, that's possible, but other facilities
Right.
may not have that, so it's just good to know.
So we basically just set up the room for the physician for placing like central lines, help them get ready if we need to.
And usually I stay in there with them only to help monitor the patient.
Okay.
And then if they need something, because they're completely sterile, so they're not going to want to leave that particular area. So if they're like, you know, hey, I need another set of gloves, I accidentally broke sterile field, or I'm going to pass out, or something, you know, the patient's not feeling well, that way you're there to monitor the patient. And also too, when they start putting in some of these lines close, you know, they get into the vena cava, they might tickle the heart a little bit, so they can kind of send them into some rhythms. And not that that's bad, that happens, but you just so you let the physician know, hey, you know, they're in VTAC, and they're like, oh, okay, and they may pull back a little bit, because they're tickling the side of the myocardium.
Are you doing like continual charting while you're like assessing the patient, like while you're in there for the
Usually,
procedure?
you do like vital signs, like maybe every 5 to 10 minutes, just to make sure the patient's tolerating it okay, and things like that. So you can chart those things. Other than that, you just kind of, if they have meds or something, maybe you could take those in there if they've got IV meds and get those started and kind of do some do other charting if you have that too.
So you think of scheduled meds during this
Yeah.
type of, okay.
Yeah, things like that, and if you've got other drips going and stuff, so.
Is this the kind of thing you'd always have a crash cart in the room with you for, like to use in case or?
Nope.
Okay.
This is one. Yeah, unless the patient's very, very unstable. But usually, if they're just getting a central line, they don't need a crash cart.
How many flushes do you usually bring with you to?
Usually 3.
Okay.
Because then they'll put a flush on each end of those catheters,
Oh, okay.
and they'll draw back and make sure that they get blood return and all that stuff.
What are those little red pieces?
Which one?
The red circles.
Buttons.
Yeah, one has like.
So this here, they'll put their needles in there, so they can count how many needles they have. And so so like all of these needles that they use, like this one they use to actually find the jugular. They'll pull back blood in this one because it's a large one. And then some of these, one does have a safety thing on them. Actually, a couple of them do. But yeah, for this one, they'll stick it in there or in here, and along with the scalpel. They'll keep it open and stick it down in there so we know where it's at, and then keep it from getting lost and everything like that. It's just a safety thing.
Once something is stuck in there, it can't be used again, or it can?
Usually they don't.
Okay.
Usually they try not to. But it could be, it is all sterile. They try not to. And yep, it comes with sutures and everything, and so they can suture in as well.
And then the IV caps, you said they would put on the end of that. Are you just talking about the white sterile cap, or what specifically are you talking about?
So I think I'm not sure if are they white?
Are they the ones that are the different colors?
Oh, like the brown, red, and
No, usually it's just like a regular, like an IV. Like on the end of your IV, you have like a piggyback on there, and it's got the.
Like what you put your flush on and then you put it on.
Yeah.
the IV cord.
okay.
They put that. That's you can get those separately,
Okay.
and then they just attach onto here.
Gotcha.
So that way, then, because really you can't. If you would leave this open and unclamped, they would bleed out because the blood would come back up into that.
Mm-hmm.
So if you have that on there, though, you can leave this unclamped and it's not going to go anywhere, the
Mhm.
blood.
Okay.
And plus it keeps that sterile because that's a direct line then right into their bloodstream.
Mm-hmm.
So it keeps it all sterile and put together. Any other questions? Okay. Any other questions in general? No? Okay. I don't have anything else for y'all, and it's 5 till, so if you need a drink or go to the bathroom or any of those sorts, you are free
Thank you.
to go. You're welcome. And thank you guys for making it in today. Appreciate it.
Your keys are still on the door, by the way.
Oh, okay, thank you. Yes, I would be looking for those later.
Last weekend I emailed him my bed list and I
Yes.
said you
Don't
got it.
know.
Yep.
You know where
Yep, I
Barb's?
sure did. I'm pretty sure I've gotten everybody so far.
I emailed mine to you, because I didn't.
Yes, if you emailed it to me, I'm pretty sure
But we are supposed to email it to you?
Yes, you
Because I
can.
haven't, so.
Oh, okay, yes, so you can email it to me,
Okay.
and I will get it and mark you off.
Perfect, thank you.
Yep.